Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. Dr. Geetinder Goyal, he is one of my favorites. He comes in each week, giving us insight of what's happening in the healthcare front. And his practice, OurWayHealth.com, is really part of an ongoing effort by a lot of different parties to revolutionize healthcare. Good to see you, sir.
Good to see you too, Kevin. Glad to be here again.
Tell us real quickly what Our Way Health is all about.
Our Way Health is all about bringing the power, knowledge, and transparency back to the consumer. And we are starting in the primary care sector. We want to offer primary care services to our patients on a direct contracting basis, where we charge them on a monthly retainer basis. It's a low fixed monthly fee, and we provide all our primary care services within that. No extra pays, no co-pays, and they get quality care. We start by building a doctor-patient relationship first and putting time back into it.
I love it. Talk about your guest today. Introduce him to us. He's been on before, and he was a great one.
Yes, it's really a joy to have Dr. Skisak back on the show. He is the executive director of Houston Business Coalition on Health, which is in fact, you know what? I'll let Dr. Skisak introduce HBCH to us.
Glad to have you on, sir. Tell us real quickly. Give us your elevator speech.
Thank you so much. Glad to be here. Houston Business Coalition on Health is an employer-centric but multi-stakeholder, in fact, all-stakeholder organization devoted to assisting employers to provide health benefits at a sustainable cost, while at the same time improving the quality of healthcare delivery and the patient experience. We currently have 61 organizational members, the majority of whom are employers. We represent about 300,000 lives in the Houston market and over 1 million nationally. We provide a variety of programs, resources, and services to accomplish our mission.
Talk a little bit about some of the overriding objectives of your organization.
We are trying to transform healthcare locally. All healthcare is local, and we do this in a variety of ways. We want to collaborate with all different types of organizations. For instance, Our Way Health, as an example, promoting primary care practice involvement is critical. If I can take a moment here, Gitu and I were at an event at the Hilton Americas. 200 people were there for a program called Cities Changing Diabetes and addressing the epidemic locally and nationally. Houston is one of the 5 target cities in the world involved in Cities Changing Diabetes. And in our program, we had representation from all stakeholders looking at specifically at Houston and what we can do to improve the health status to minimize the impact of diabetes. And one of the messages that came out loud and clear is to look for ways to engage patients better with their primary care physician. That's an example that I can give.
Very good. Geetinder?
Yeah, I agree with Chris here. You know, I really enjoyed going to the meeting, Cities Changing Diabetes. I've been to a couple of similar meetings that HBCH holds, and I think HBCH is an excellent platform for bringing different stakeholders together to talk about some of the things we can do to change healthcare locally, as Chris mentioned. And the recurring theme has been primary care. You know, that look, we have to start with strengthening our primary care system first. Chris, also talk about a little bit about some of the new things that you guys are trying to do, like via your newsletter, because you guys are coming up with a member spotlight section in your newsletter, which is focus on some of the employers in the city, as well as a innovation center in the newsletter.
Very good. Yes. We want to be able to communicate to the Houston marketplace the good things that are happening, and there are a lot of good things happening. So we will be next year bi-monthly having a member spotlight to focus on those members, organizational members, who are really impacting the quality of care, the cost of care, and the patient experience. We also want to be able to provide a forum for providers who have innovative ideas such as yours to get their message out, to talk about that innovation and how it can change the discussion and the dynamic. And we hope by doing that, by exemplifying these best practices, and then ultimately using collective influence to drive improvements in our local markets for the betterment of healthcare.
Seems to me that organizations like you are really an indication that we're in a turning point when it comes to our culture in healthcare. You know, for decades, it was just one of those things we did. It was like buying electricity. It was almost like a vendor. And then all of a sudden, it's like organizations, businesses in particular, have gotten very concerned about how their employees are taken care of, not only in terms of their bottom line, but in the health of their employees in general. Kind of give us some major things that you think are benchmarks that led to this shift of concern and the growth of an organization like yours.
Well, the cost is one thing, and I gave a talk a few weeks ago on the future of employer-sponsored healthcare, and it was called almost Back to the Future because we've tried so many different things that haven't worked. I think we're at a tipping point right now where employers they're trying to control costs, but they also now can link better the financial sustainability of their organization by having healthier employees. There's enough information out there to show that healthier employees are more productive and contribute more to the bottom line. So employers are trying to balance that divide between healthcare cost and productivity. I think that's about as well as I can say it right now.
I think you did it very well. Geetinder, we have about a minute or so left. And by the way, it's Our Way Health is your website. And Chris's website, you can find out more about what he's doing over at houstonbch.org. With about a little more than a minute left, final thoughts for the listener today.
Chris hit it on the head that healthy employees are productive employees, and the best resource an employer has is their people. And a lot of the progressive employers out there are realizing that fact, and they are trying to maximize the health benefits for their employees. That makes the company look attractive. That makes the core people healthier and focused on the job at hand. And they stay with the company. And I think health and healthcare benefits are a key part of that. And I encourage anybody out there, listening to the show, employers, small or large, to really look at what HBCH is doing and consider joining the organization because there's tremendous value going forward for them.
Chris, give us a sense of the size range of your membership.
We have all different sizes. We have our largest employers with tens of thousands of employees in the Houston market. We have mid-size employers, 5,000 to 10,000. We have small employers. We provide a forum for the sharing of what works and what doesn't work.
Geetinder Goyal, Chris Skisak, great interview as usual. Make sure you check them both out, ourwayhealth.com and houstonbch.org. Thank you.
Thank you. Thank you.
When we come back, much more for you. You've been listening to The Price of Business.